Hi, this is Dr. Angelique Millette, and I'm going to speak with you about object permanence. Object permanence starts around the time your baby's 8 or 9 months of age. It's a big developmental stage. It's full of the promise of what we call pre-toddlerhood and lots of emotions and your baby's push for independence. So a few of the traits of object permanence that you'll notice right away will be what's called stranger anxiety and separation anxiety. Stranger anxiety means that your 8 or 9 month old or 10-month old might burst into tears if a stranger comes up to them and starts chatting with them or makes a funny face. And then separation anxiety means that if you were to, say, be playing with your baby and then you get up to go get a glass of water, your baby bursts into tears at the thought of you leaving. All of these kinds of traits, so these kinds of separations, are normal, and your child's response is completely normal. A lot of parents get a little bit concerned by their child's response. They've never seen something like that before. They think something bad might be happening, but in fact it's completely normal, and it's a sign that your baby's securely attached. They feel very confident and secure enough to let you know when they feel upset that you're leaving. So the big traits that we're looking for, separation anxiety and stranger anxiety, can also occur at night. Sleep for a baby is about letting go of you so that a little one can go to sleep. And so they separate from a parent and they go to sleep. And because of the sudden onset of object permanence, again, all very normal, and increased separation anxiety, your baby might get very upset at bedtimes or wake up in the middle of the night very upset and insecure. I don't find sleep training or sleep methods to work as well. Sometimes they do, sometimes they don't. Sometimes we have to put all sleep changes or feed changes on hold, and I ask parents to just be responsive to their baby's needs. If the baby is waking at night and needing the parent, and it seems to have just come out of nowhere, and your baby is awake for 1 or 2 hours in the middle of the night, it's very likely the beginning of object permanence and pre-toddlerhood. It can last a couple nights to a couple weeks, and you want to be responsive to your child's needs during that time. That might include rocking and holding. That might include letting your child figure it out a little bit. But if you're not seeing your child figure it out and you're seeing an escalation of crying, certainly respond to your child. Some parents might even have to start feeding a baby at night again for a baby that may not have been feeding at night. So follow your intuition during this time. It's really important. Know that it's completely normal if you are seeing a sudden increase in separation anxiety and stranger anxiety starting around 8 or 9 or 10 months of age. It is the beginning of object permanence. It's the beginning of your toddlerhood for your little ones, where they're getting a lot more emotions. It'll eventually usher in the beginning of your little one wanting to control and be more independent and master. You'll notice more self-feeding. You'll see an interest in potty learning, and all of that is part of the beginning of object permanence. So thanks so much for listening in, and if you want more information about object permanence or other topics related to sleep and child behavior, please check out my website, www.angeliquemillette.com. My name is Dr. Angelique Millette. Thanks so much for your time today.